So I'm here. We're here at CLAS 2017. I've got Mr. Nasser next to me here, who gave a fascinating talk on body dysmorphia. And would you say that that is something that's relevant to all aesthetic practitioners?
I think so. There are the people who just do aesthetic medicine, treatment of problems using fillers, injections, and toxins, and there are those who do proper invasive procedures such as surgery. I'm not one of those who has been trained or familiar with the injectable stuff. I do use some Botox occasionally in my patients, but I found it very relevant because at least I know where there's an alternative available as against surgery. So it's useful. It's really useful.
Great. Yeah, I've certainly enjoyed it today. I feel it's a very international crowd with people coming from all over the planet, all with an insight into different procedures, different. I guess also there's sort of different aesthetics that go on with different sort of facial types, different skin types, that type of thing. So I guess that's also something that you've come across in your own work.
I do, but my role here was to illustrate the anatomy of the nose. This is a particular reference to anatomical landmarks, making people aware of the presence of blood vessels and nerves, etc., in areas where injections are fraught with danger. And that was my remit. And I also had to give one lecture on the careful patient selection and avoiding those patients in whom there may be a psychological overlay which would otherwise negate a good result or even make problems for the practitioner.
Yes, I can imagine that when people pay. Well, this was also covered in today's session, that when people require surgery for life-threatening conditions, regardless of the outcome, visual outcome.
Grateful.
Yes.
In the aesthetic world, it's a very different story.
Yes.
Because the objectives are different.
Yeah.
And if they're not met in accordance with the expectations of the patients, then the game turns south.
Yes.
And that's where the problems begin.
Yeah. Yeah, and I think, I mean, for me, it was very interesting because I saw some slides where where there had been some sort of complications, and there you can see why the client would be unhappy. But for example, in the slides that you showed, the outcomes were, in my opinion, very good. But this was something to do with the kind of psychological
mind state.
Yes.
Mental state.
Yes. Yeah. So I guess these are all kind of levels of complication that anybody involved in this field needs to take on and be
really fully aware.
Yes.
Because once you've taken them on, it's too late.
Yes.
The process should be really at a stage when you are considering embarking on the treatment, and you have every opportunity to back off and ask your patient to back off.
Yeah.
And if there are those patients whom you feel uncomfortable with, don't operate. Don't do anything to them. Send them away. Let them go and find someone else.
And I found it very interesting that that's exactly what you said that people did. That you would then find out that they had gone to yeah. So I guess that gives me an insight into the determination of these people, despite the fact that
find someone who will do it for them.
Yes. Yes. Great. Well, thank you very much for giving me some of your time. I know that we've got the last few sessions of the day to go. So thank you very much indeed, Mr. Nasser.
Thank you.
Thank you.